Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and here we take a stock of India's fight against COVID-19 pandemic. Now, one of the very important aspects in this battle is to identify as to when a person is infected with COVID-19, and that is done via the symptoms which are exhibited by the patients who is infected with this particular virus. Today, we're going to talk about the order of these symptoms. Now, one study has been done by scientists in a university in the United States, which seeks to go ahead and pinpoint the specific order of symptoms when you talk about COVID-19. And it becomes really important right now as well, because this is a monsoon season. There are several other diseases in play here which have almost similar symptoms as to COVID-19. We'll talk about all these symptoms in detail, how a person can identify, and how this particular new study will help the clinicians as well. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce the guests to you, beginning with Dr. Samiran Panda. He's a scientist and head of the ECD at ICMR. We are also joined by Dr. Anil Gurtoo, director, professor, and head of the Department of Medicine at Lady Hardinge Medical College, and Dr.Archisman Mohapatra, an epidemiologist, as well as executive director at the Grid Council. Welcome all of you gentlemen to Rajya Sabha TV. Let me begin with you, Dr. Mohapatra, and let's first focus on the study in which we're talking about here in terms of the order of symptoms of COVID-19. What does it say?
Yeah, this study that has come, I see that the authors are representing different countries, but majorly led by University of Southern California. And what they have done is they have used some advanced modeling technique, and they have used data sets as and when they were available, mostly during February, fairly early into the pandemic. From a global perspective, they use the data from China, and they have tried to play around with the sequence, different type of sequencing of the symptoms. And what they really found out is there is a particular sequence. Like first you get fever, then you get cough, then upper GI symptoms, and then you have lower GI diarrhea symptoms. So their estimates seem to be fairly robust because they used a good model. They used a stochastic modeling technique and Markov processing. And the data sets are also quite good in number. But there are certain limitations. Of course, this sets out a new direction into the way we are looking at the disease and its management. They try to build a case that by noting down very carefully the ordering of the different symptoms, that will help us in maintaining a higher vigil in terms of COVID-19, because now it's a conglomeration. The seasonality also exposes us to a variety of other conditions. So COVID-19 and other influenza, as well as part of the country, are part of the world where we have too many other viral and parasitic conditions as well, which present more or less with similar symptoms like fever, body ache, those kind of symptoms. So kind of high vigil. That is what they're advocating for.
Okay. So it sort of is focused as ensuring that there is a high vigil in these tough times. Let me bring in Dr. Panda. Hey, Dr. Panda, according to you, why would it be so important to go ahead and pinpoint the exact order of symptoms? We're almost in the middle of pandemic. It is almost 6 months since we are talking about and educating people as well about what might be or what are actually symptoms of COVID-19, but the order specifically, why is it that significant?
Yeah, that's a very good question, because now we understand that in COVID-19 situation, it's impossible to extend the lockdown period indefinitely. So one would certainly try to go through a phase when slowly unlocking would happen, and people would start not only moving in large numbers in order to attend offices, but would also try visit places, for example, the marketplace or shopping mall. And then there will be a necessity, because as we know about the natural history of the disease, it's not only about a population group within a defined period of time, but at a gap of a few months, there is an expectation from the past occurrences of so-called Spanish flu, although it was not happening only in Spain. Spain only reported larger number. That's why people, the name Spanish flu stuck with the disease. But then we are aware of the second wave happening or the third wave happening. So given that is going to happen, how one would expect or conduct screening while the process of unlocking would happen? So in order to have an effective screening, what are the most commonly occurring symptoms that one should look for? For example, we use the thermal scanner in the offices. Similar kind of thing, and how much importance should be attached to each of these symptoms. So that's the whole purpose. So the order of symptoms, not necessarily, that's us who are trying to understand the virus and the disease process caused by the virus. But whether virus would very strictly and diligently follow that order is not really known. So it's not going to be an all or none phenomena, which by which I mean that not that everybody will have fever first. So if we do use thermal scanner, everybody who is infected will be captured right at the beginning. It's not going to happen that way. But what would happen if we have fairly good idea about the occurrence of the first disease symptom when somebody is infected with SARS-CoV-2 in a large number or majority of the population, then we might have fairly good handle on the screening. So in essence, what I'm trying to say is that it's a symptom constellation that all of us are aware of. Fever, cough, and the difficulty in respiration, we call it dyspnea. And there are other symptoms as well. But then what happens in most of the situations and at the beginning? That's what the article was aiming to know, which might help the screening process and how much would be the sensitivity and the specificity of that symptom. So in order to capture that, the group of scientists attempted this. So that's my take from the paper that you were referring to.
Okay, let's bring in Dr. Gurtoo here as well. Dr. Anil Gurtoo, from a clinician's point of view and somebody who has been involved with the treatment of COVID-19 patients for quite some time now, how important do you think is this ordering of symptoms? And is it very, very helpful when we are talking about the screening process and the days ahead of us? And obviously, to be prepared for, as Dr. Panda is saying, if at all there is a second wave or third wave, which we have witnessed in previous plagues as well, previous pandemics as well.
So, as a clinician, looking at what just Dr. Mohapatra explained so well, the model, I realize two things. One, this data set has emerged out of a mathematical model. It is the Markovian model based on the progressive stochastic process. So I'm a clinician. I deal with patients, the practical bedside. Now, this is a mathematical model. I deal with biology. Biology in interaction with social norms, which is COVID pandemic, creates a lot of variation, a lot of variability. From that perspective, a Markovian model is a very good model to begin with, but it needs to be replicated in the clinical real-time contexts of patients in terms of a longitudinal, a prospective study that begins to look at symptoms, symptom by symptom in the real life conditions. But as a beginning, this is a very good technique because let's look at this COVID pandemic. There is a very good model called the Black Swan model, which was built way back in 2001 by a mathematician called Nicholas Taleb. You may have read that book also. A Black Swan event is an event that creates a rupture with the past. Now, when I use in my daily life or my clinical life work to prediction is about future from the present. I use the past, so-called experience, the past as a prediction tool to what comes in future. Now, conditions like COVID pandemic or that financial crisis of 2008, they're almost the same when you look at from a Markovian window. They broke the connection between the past and the present and its predictability towards future. All the medical models we use are based on the basic assumption that past predicts future. Past we had flu, past we had SARS and MERS, and so with this. But this clearly shows that past predictions do not hold as a tool, as a projection for the future. So when such breaks occur between past and future, past and present, a Markovian model is a very good technique to study this. So this has brought in a certain ordering, a sequence. Now that sequence is based on mathematical assumptions that one symptom comes at a time and every patient will experience all those 4 symptoms if he doesn't die. Both these assumptions hold for a mathematical model, but whether they will hold on a clinical basis in biological circumstances marked with variation and variability is a thing that needs to be tested. Okay. However, as a preliminary outcome, this study is very useful because it can be placed as an algorithm, and it is as an algorithm to screen, to predict individual case that we encounter, whether is this COVID or not, and also most importantly as a surveillance tool, what we call syndromic surveillance, because this gives us a cluster of symptoms called a syndrome. And if this holds, then we can use it for all the 3 perspectives, individual, one-to-one, whether this person has COVID or not. Let us go as algorithm. First comes fever, then comes cough, then comes upper GI symptoms, and last to come are the lower gastrointestinal symptom, diarrhea. The ordering as was brought out very well with Dr. Panda and Dr. Mohapatra. The second is screening, fever. This clearly shows that fever happens to be the most common initial symptom. So this fever could be screened using a simple screening gun or something in mass. And the third is the surveillance, syndromic surveillance. Okay. So from that, however, the limitation is that this disease transmits maximally in the pre-symptomatic phase, 2 days before the symptoms begin or set in. So the most transmission, the damage from community transmission perspective happens then, which this model will not be able to pick up. That would be the only limitation.
That's a very interesting point. And I'd like to bring in Dr. Mohapatra and Dr. Panda on that as well. But one more point, which I would like to bring to you here, Dr. Gurtoo, is vis-a-vis the symptoms which you spoke about. Fever specifically seems to be one of the major symptoms when we talk about COVID-19 patients. But these are, monsoon times, monsoon season in this part of the world. And as Dr. Mohapatra was saying, we have various other virus-based ailments or diseases like the viral fever or dengue, which we are looking at, chikungunya or malaria. And then fever seems to be a common symptom there as well. So does this also gives some help to the clinicians, ordering the symptoms like this to try and identify the pandemic cases specifically at the initial stage itself, rather than, perhaps waste a bit of a very precious time in doing that, because as you said, the spread of the virus is in the initial days is too much.
Yeah. So the problem is that as a tool to discriminate various kinds of febrile illnesses that are prevalent right now, we don't know whether this model holds or not. This model has been built from a mathematical model, the Markovian progressive stochastic process modeling. Whether it will apply as a tool to segregate, to discriminate dengue, malaria from COVID was probably not the aim of this model. This model was basically aiming itself to position itself as a good surveillance thing from a COVID perspective, COVID, non-COVID. That is COVID versus non-COVID, that the universe of non-COVID, the space of non-COVID has so many other malaria, enteric, typhoid, dengue, chikungunya, and other influenzas as well, which are circulating these days. So,
But Dr. Gurtoo, as a clinician on the ground, how are you going about it? Because you must have been encountering with a lot of patients with similar symptoms, but they seem to be affected with dengue or malaria perhaps, or maybe viral fever just.
So take the three, like today itself, just before the program, we had this very conundrum, this very issue to sort out. There were three patients, all the three presenting with fever. The issue was which one to admit where, because any COVID suspect would have to be cleared by RT-PCR testing before we send them into the green zone. So the quick discriminator here is essentially COVID is a respiratory disorder to begin with. It can generalize thereafter. So fever plus cough in the current times equals probable COVID. Fever plus severe body aches, so severe that the person cannot get up from bed, and pain on moving the eyes equals probable dengue. High-grade fever with chills and rigors, shaking chills and rigors, which divides itself in three distinct phases: hot, cold, hot, and wet. Begins with shivering and chilliness, leads on to perception of fever, ends in drenching sweats. The three phases. Comes very acutely, rises and falls. Every third day, particularly if this pattern is malaria-like illness or probable malaria. And then there remains a vast cluster of influenza-like illnesses, which are not really COVID, non-COVID influenza, para-influenza, rhinovirus, and other influenzas, which is the most common, but not COVID. Here, according to this study that Dr. Mohapatra just mentioned, that if the symptom of fever comes before cough, fever, then cough, it is likely to be COVID according to this. But if it begins with cough and then sudden sharp high-grade fever follows, it is more likely to be non-COVID influenza.
Okay.
From this study, that again has come to us, two symptoms and two discriminators. So that way, this study may help if it is validated by clinical studies hereafter.
Okay. Dr. Panda, your views on that? Fever and cough, turns out to be the two discriminators when we are looking at COVID and non-COVID. And it becomes really important in today's scenario to identify these discriminators as well, because as Dr. Gurtoo was saying, this must be a dichotoma, or dilemma, which the clinicians might be facing on a daily basis with so many patients coming in with, dengue or malaria or perhaps viral fever.
I would say model is as good as the data is which contributed to the development of the model, and the context in which the data for developing the model was collected or gathered. For example, if you had a patient population coming to a hospital and got the history in order to know what has been the sequence, and based on that data you develop that model, so it will be specific to the group of people or the patients who contributed to the data giving rise to the model. Now, application or applicability of that model in a different context, which is maybe a general community, might give rise to a good result or might give rise to a disastrous result. We don't know. So if the purpose of the model is to indicate that, well, now we are going to go through the process of unlocking, and we have to have some screening mechanism. And as this model indicates that fever could be an early indicator of a second wave of spread of SARS-CoV-2, that could help in population level screening. So one is the clinical decision making for patient management. The way I read the discussion, it did talk about population level efficacy of the model, probably not the clinical management. So each model has its own strengths as well as limitations. So I would say that fever is a very common symptom, as all of us know, or cough, and it happens actually in many diseases. So in a particular season, in a particular context, applicability of symptom constellation would have higher sensitivity or lower sensitivity. So it is dependent not only about the presence or absence of a symptom, but in whom, at which group, and in which season. All those contextual factors are also very important.
Okay, definitely. And you rightly pointed out, any model is as good as the data applied to that particular model. And here, the data is varied, not only according to the population of the geography, but also according to the weather conditions as well. That brings me to Dr. Mohapatra. Dr. Mohapatra, as Dr. Panda is saying, and if you're looking at the community health perspective here, or the management, and which you're mentioning in your initial comments as well, how significant might be this entire process of ordering the symptoms or identifying them, because this is a fight which is not going away so soon.
See, let's simplify the story here. Science always has a theoretical component and a practical aspect as well. So that's exactly where Dr. Panda and Dr. Gurtoo are emphasizing. So the information that is flowing from this paper is absolute theory. In India, there are many other factors which will determine the sequence or the manifestations. For example, we have different strains, we have different body physiologies, and of course, we have different risk factor profiles. As you said, so someone is having diabetes, others do not have diabetes, hypertension, environmental conditions. There are n number of other factors which will actually determine how a disease will manifest. And of course, when a clinician or a doctor would see a patient, he doesn't actually go entirely by just symptomatology. So in his mind, he or she is so well trained that gets a series of differential diagnosis. Of course, we are in the middle of a pandemic, so the suspicion will be really high for COVID. But other conditions are also there. So we know that we are into some seasonal aspect. We are unlocking many things are coming into play, and the doctor definitely keeps those things in mind, and of course takes help of other investigations, other resources that are at hand. So that's why this paper they have positioned very carefully from the population perspective. So they are just trying to say that, okay, if you have fever, please be very fast in seeking a medical help. Please reach out. Don't stay back home. The entire crux is to get an early, some intervention, early diagnosis if possible, and to isolate yourself so that you don't end up spreading it to others. So but it's I absolutely would say that this is a starting point, a good starting point. But from this paper, we have many other aspects of validation, contextualization, using real life data with robust definitions. Like how did you define the symptoms? How did you define the order? So there are many aspects to it to do a very good study. Dr. Gurtoo also emphasized on that, to have a prospective design, a cohort where you can actually have that kind of a sequencing. And of course, what Dr. Panda also said, that it's a constellation. So don't be just carried away waiting for a sequence to appear. It doesn't appear that way.
Okay, definitely. Science has two aspects, as Dr. Mohapatra says, theoretical and practical as well. And both have to be seen in combination with each other rather than in isolation. Then only it works. But that brings me to the final question to Dr. Gurtoo before we bring this discussion to an end. And Dr. Gurtoo, the final one is to bring a bit more clarity to the layman, to general people like me, to try and understand, as to how do we identify, once again, you pointed out, in your earlier response about various symptoms. But now today, in today's condition, today's situation, it's a monsoon season. So how do we look at the identifiers or the symptoms specifically for a COVID or a non-COVID sort of scenario?
See, what I can only tell you what the kind of a model I use in my clinical practice. A person comes with fever. Doctor, I have fever. If there is fever, then we ask, what else? Apart from fever, do you have any other symptom? If the answer is yes, explain what. Cough. The commonest cluster, the bare basic bone, the actual core is fever plus cough, fever plus dry cough. If these two are there in today's conditions, prevailing epidemiologic settings, our probabilities, the probabilities that generate out of this constellation is rule out COVID-19, rule it out. That is the first pathway that flows out of the symptom fever. The second is, no, I don't have cough. Now, COVID is essentially a respiratory disease. As I said, to begin with, it embeds in the upper respiratory tract and then flows down to the lower respiratory tract. So beginning with the cough, some pain, throat and cough, and then breathlessness in case it gets more severe. So if the answer is no cough, only fever, then the pathway that it shifts towards other things like dengue, malaria. Now, if it is dengue or malaria, the fever is usually very intense, very severe, very episodic, goes up and comes down in spikes, very steep spikes, rises and falls. In malaria, you have those triple, very commonly, the patient will experience that triple phase of feeling very cold to begin with, teeth chattering, rigors and chills, the chilliness, followed by the real fever, the hot phase. And then it suddenly plunges into sweats. They break out into sweats. So cold, hot and wet kind of a phase built under a very steep curve of fever, rising and falling and coming again and again and again. So that is usually malaria. Now, if this is fever but no cough, marked body pains, every muscle and every bone and every joint in the body is so painful that it's difficult to get up from the bed. Whereas by yesterday, before I went to bed, I could run around. When I woke up with fever and with such a severe body pains and aches that I cannot even get up. That is a clue to a dengue or chikungunya, one of those two. Dengue is more prevalent today in Delhi. Chikungunya is not really as much today. So these are the three common things, and others are of course there, but
So I have, primarily, as all of you are saying, COVID-19 is a respiratory disease. And when you talk about, symptoms, it is really more important to look at specific symptoms rather than the orders, because the order can vary with respect to a population, set of population or weather conditions as well. Thank you so much, Dr. Mohapatra, Dr. Samiran Panda, and Dr. Gurtoo as well for sharing your views with us and our viewers. It is indeed tough time and dynamic situation as well. We are learning on the go about this particular disease and also how to deal with it. But the most important and significant aspect, once again, we would like to remind you, is to ensure that you put up a face mask when you step out of your house, because that's the best and the primary defense against COVID-19. Thank you so much for watching Rajya Sabha Television. We'll come back again tomorrow with a different topic. Till then, keep watching.